Hello everyone. Hello everyone. I'm just waiting on Dr. Reema to join and we'll begin shortly. I hope everyone is doing well. How is winters for everyone? I'm just waiting on Dr. Reema to join us and then we'll begin shortly. Yeah, it indeed is pretty cold. You will find me in jackets very rarely. Till Dr. Reema joins us, let me just tell you all that anybody who has any questions or any remarks, they can just put down all your questions in the question box right there. All right, and then we'll be taking. Okay, Dr. Reema is here. One sec. Hello, can
Hi.
you hear me?
Yeah, I can hear you. Hi.
Hi, sir. Hello, how are you?
I'm good. How are you?
I'm doing great. How's how's everything?
All good, except the cold.
All
So where are you all based out of exactly?
We are all actually working remotely, so all of us are in different
Oh,
areas of India. Yeah.
okay, nice.
Yes. Um, okay. For anybody who has joined just now, I just want to explain to everybody that any questions that you have for doctor can be put down in the question box right there on your screen, and we'll be getting to them at the end of the session. All right. Let us begin.
Yeah.
So, Dr. Reema, tell us something about yourself. How introduce yourself?
So I am Dr. Reema Ranka. I'm a women's health physiotherapist and a certified child birth educator. So apart from seeing normal physiotherapy patients, I see a lot of patients that deal with infertility, PCOS,
Yeah.
pregnancy, post-delivery, incontinence, and many other issues related to women. So I try and treat them not with medicines, but the natural ways, like, lifestyle modification, diet, exercise, in that way.
Correct. Okay. Um, so as a pregnancy and fertility coach, what are some of the most common issues that women come to you for?
Most of them come with PCOS, endometriosis. That is the most common issue most of them face. PCOS being the most common one nowadays, because what is happening is because of the diet and lifestyle changes.
Correct.
Sedentary lifestyle that we are having, the diet that we are having, because of that, it is becoming a little more common these days.
Yeah. Okay. So moving forward, we would like to know from you, what are the causes of infertility?
Causes of infertility are many, starting with first one being an unknown cause, as in there is no particular cause, but you still can't conceive. And then we have a variety of causes, right from PCOS, cyst, endometriosis. Endometriosis, is usually founded by a very painful period. Your uterus lining is very thick. That is one of the reasons. There can be polyps, there can be fallopian tube blocks, there can be so many small unresolved or undiagnosed issues, which is very, it's a very vast term, infertility. but it's very wrong to, just label everyone infertile like that, because infertility is just subjective. You might be infertile today, you can change things, you can take things in your hand and become
Oh,
fertile
okay.
tomorrow.
Amazing. Now that we know that the reasons of infertility, we would like to know from you the solutions women can choose to get pregnant if they are going to have fertility issues.
So the the first and the most basic thing is just work on your own health, work on your own diet, work on your own lifestyle, because that is the base of everything. Once that you go to a doctor and someone labels you infertile, you already lose your the mental balance, you go into
Yes.
stress, which releases and triggers a lot more other hormones, and
Yeah.
in the end giving you a little more infertility. So first of all, don't term yourself as infertile, or don't try and run behind quick treatments, instant treatments. So I have patients who have asked, I want to conceive in 1 month. Doctor, can you do something very quickly? So this is not instant noodles. It is all going
Yeah.
to take time. It is all going to take patience. So the treatment for everything is just working on your own health and working on your own self.
Correct. Okay. In today's times, we have heard many young women coming up with the issue of PCOS. So, what are the first signs of PCOS, and can it be treated permanently?
Yeah, so the signs of PCOS in young girls specifically would be acne. You get
Okay.
everyone, but a lot of acne. Hirsutism, which is hair growing, till almost till ear. Then you
Okay.
have hair growing in body parts, like on nipples also they are having hair. They're having hair loss. They're having mood swings, irritabilities. And the most common and important symptom is periods are not regular for
Oh,
1 month, 2 months, but this is not for everyone. And another common thing seen in PCOS is obesity, weight gain, abdominal weight gain. But again, this is
okay.
stereotype. It's not for everyone. Not everyone has irregular periods. Not everyone has abdominal fat. So there can be many small reasons, which why the female is getting this abdominal fat. So just that
Right.
because you are fat does not mean you have PCOS.
Hmm.
PCOS. Just because you have PCOS does not mean you have to be fat.
Yeah.
Okay. And what was your second question? Sorry, you asked me the symptoms and
Um, yeah. How can it be treated permanently?
yeah, it
If it can be.
it
If it can be.
yes, it can be treated permanently, but more than that, it is a lifestyle disorder. So first of all, the full form of PCOS is polycystic ovarian syndrome.
Yeah.
It is a syndrome, not a disease. So it is just a temporary thing which you can change with your diet and your lifestyle changes. So it is not something which needs to be cured. It is just there, but it can go, it can be reversed if you take things in your hand.
Right. Okay. So now we'll move on, and we'll do a little bit of busting some myths related to PCOS.
Okay.
All right. Okay. So the biggest myth that we have heard is that women with PCOS cannot get pregnant. Is that true?
It is not at all true. In fact, we've also had pregnant ladies who have active cysts in the ovaries and they are yet pregnant
Oh.
with them. So ये एक बहुत बड़ा myth है,
Hmm.
especially in India. It is just the time the young girl gets PCOS, the second statement she has to hear is, now you're going to have difficult time
Yeah.
babies. But it is not at all true. What is PCOD? So I just want to quickly explain what is PCOD. Every month, the women's body produces one egg which gives rise to, if it gets sperm, you get a baby. If it doesn't get the sperm, your endometrium grows and it sheds off because the baby is not born. Okay, so it is just one good egg out of the many small eggs which grows and then deteriorates, and then you have your periods. What happens in PCOS is your body cannot understand whether that one small egg has been formed or not because of the hormonal imbalance. So instead of forming one proper egg, it
Hmm.
forms many small eggs, like a basket of eggs. So because of that, the period gets delayed because the body cannot understand only कि whether वो egg बना है या नहीं बना है, उसको sperm मिला है या नहीं मिला है. So because of that, the entire period cycle goes for a toss, and that is why you have PCOD. So PCOS.
Okay.
Yeah.
And that might cause the delay of periods as well. Okay. And so if now that we know that it's not, then what are the reasons why people's mindsets are built that way, and what would be the solution to change
Like I
that
told,
mindset?
because the period is not regular. So like normal females, you can't actually track your periods. You can't actually be sure whether it is your fertile period, whether it's your ovulation time. So there is a lot of confusion that, whether, should I be, trying on these days or that day. So that is why there is this misconception that with PCOS, it is difficult to conceive. Also,
Right.
what happens, like I said, एक egg की जगह बहुत सारे छोटे छोटे eggs बने. So the quality of the egg is obviously going to be a little lesser. So it
Yeah.
is a little difficult to conceive than compared to normal females, but doesn't mean that you cannot conceive with PCOS.
Right. Okay. Um, Another thing that we might have heard is that if you have PCOS and irregular menstrual cycle, you don't have to worry about the irregularity until and unless you're trying to get pregnant.
No, you should worry about the regularity, because like I said, it just means that your body is producing too many follicles, having too many mood shifts, mood swings, hormonal imbalances, food cravings, weight gains. Everything is going for a toss because your periods is not coming on time. So periods is very, very helpful for a female's body to regulate her monthly hormones every month, to get that detox. It is kind of a detox. So periods is actually important. So it's not that only if you're trying to conceive, you should be concerned about your period cycles. You should be concerned about your period cycles irrespective.
Right. Now that we are halfway into the session, I just want to mention once again to anybody who's new and joined right now. Anybody who has any questions for doctor can put it right there on the comment box on your screen, and we'll be getting to them at the end of this session. All right. Moving on. Women with PCOS do not have to use contraceptives. Is that true?
No, it's not at all true. In fact, you have to be even more careful because you don't know when you're ovulating. You can never be sure when you're ovulating. So if you do not want a pregnancy, you have to, in fact, use contraceptives even more.
Okay. People believe that one cannot give a healthy pregnancy if they have, if they have or are diagnosed with PCOS.
No.
Is that true?
Not true, because yeah, of course the egg quality is compromised, but if you improve the egg quality, if you improve your diet, if you improve the AMH levels of your eggs, you improve the quality of the eggs, then there is no chance that your pregnancy won't be normal, or you can't deliver normally, or you will have to go for some treatments. It really doesn't depend on that.
Correct. Okay. Hormones are always used in the treatment of PCOS. Is that right?
Yeah. So if you go to the medicinal part of it, hormones is the baseline treatment available, because like I said, because the body is getting confused because of the small eggs. So कभी ज़्यादा hormone कम बन रहा है, estrogen ज़्यादा है, progesterone कम है. So except of giving medicinal hormones, there is no other treatment as such in medical terms. But if you go for lifestyle modifications, there are a lot of things that you can do.
Correct. Okay. Are cysts always PCOS?
No. So there are different types of cysts which are there. Some cysts cannot. So cyst, what is cyst? Cyst is like a water bubble formed on the top of a basket of eggs. So it's not always polycystic. It can be many other types of cysts as well. So don't just cyst पढ़ के एकदम panic मत हो जाओ. Get it properly scanned by get a sonography done. Meet your gynecologist. Understand what it is. So instead of just worrying about what has happened to me, please get the proper diagnosis and find out that exactly what can I do about it.
Okay. So one cannot have PCOS if they have regular periods?
No,
is that true?
That is not true. So like I said, you might have regular periods, you might be lean, you might have no other symptoms, but still your cyst may be polycystic in morphology, which means they are still producing a lot of small eggs and still giving you hormonal imbalance. So there is a very fine line of deciding whether you are actually a PCOS or not. So that is why I said, please meet a good gynecologist and get it diagnosed properly before just jumping into conclusions that I have PCOS and panicking for the same.
Right. Okay. And lastly, fertility treatment is a must if someone has PCOS. Is that true?
No, that is not true. You just have, like I'm repeating this again, but you just have to work on yourself. You just have to work on your health. You have to work on your quality of eggs, and you do not need any kind of fertility treatments as such. But again, if due to some reason, if your egg reserve is low, if the egg quality is bad, you can go for options like IUI and IVF, but that are the last options. Before jumping to IUI and IVF, give yourself and give your body a try. Give yourself at least 1 year of dedication to improve your health, and then you might think, okay, let me think of some other treatment options.
Right. Okay. Okay, I think those are all the myths. And one last question for you. Any tips for the women audience who are listening to us in terms of dietary changes?
So dietary changes, I would like to mention that, one very common myth is you cannot have milk and milk products with PCOD. So that's
Okay.
true at all. You can actually have milk and milk products. You can have whatever you want. The importance is the portion size, that you are not overeating.
Okay.
You have to maintain a particular portion size, and you don't have to stress about what you're eating. So when you go into stress, looking at some kind of food, that whether this is going to make me gain weight, this is going to improve my health, so it's not going to work that way. So just, and one thing that you can include in your diet would be B12 rich foods, which can be sprouts or pomegranates, beetroot, any food which is rich in B12, that will help you in improving your period cycles.
All right. Okay, those are all the questions that I have for you today. We'll move on to the questions from the audience. Anybody who has any questions, please put them in the comment box right there, or there's a big question mark box as well. So I'm just going to read out the questions for you.
Yeah.
What are scanty periods? And I am 32 years old.
What is the reason for scanty periods? It can be PCOD, it can be hormonal disturbances, it can be lower AMH levels. So you need to get it diagnosed properly. You need to get your blood test done to check that what is the actual reason that is giving you this scanty periods. And it is not normal. If you're having scanty periods, then please get yourself assessed and check that what is the reason for this. Now, what is scanty periods for those women listeners who are, what is scanty periods? So if you don't have to change your pad twice or thrice a day, that means your period is scanty.
Okay. All right. Sorry, can you see me properly?
Yes.
I think I'm getting a little pixelated or anything.
No, I can see you.
All right. Next question. What exactly should be considered as a delayed period?
Delayed period would be if your periods are not coming even after 40-45 days. And if that cycle is repeating every month. For once, if it is delayed, it is okay. But if every month it's like 45 days, 50 days, 60 days, 90 days, then that is a delayed periods.
Okay. If there is a history of fibroids and PCOS in the family, then how can it be prevented in the upcoming generation?
You can prevent it by changing your diet and lifestyle. So just like diabetes is also a genetic disease, right? But if you are aware that your parents have diabetes, so you will, I'm sure, be a little more careful when you choose your sugars. So similarly, if you are a PCOS person, you yourself have to be careful of especially cutting out fast foods from your diet, maida from your diet. So you have to be a little picky and choosy on what you're eating.
Okay. All right. Should medication be taken in case of severe period pain?
Yes. So if you're having severe period pain and if it is not getting cured even by 2 or 3 meftals, if you can take meftal spas, you can take drotinum once or twice a day. But even
Okay.
after taking that, if you're still having very, very painful periods, something that you cannot bear, you're vomiting, you're just rolling around and you just cannot take it, then you should definitely get it diagnosed.
Okay. Getting a cramp-like feeling, but periods are not coming. So what is the reason?
Periods might be on the way. That when the periods are on the way, you definitely get those cramps. So if you really are getting annoyed with those cramps, you can have ajwain water, ajwain or ova, carom seeds. So just boil them in water and drink 1 or 2 glasses with a little ginger maybe. So it will help you in getting you your periods.
Okay. Once PCOS is treated, are there any chances that it can happen again?
Yes. There are chances. So if I'm cured of PCOS and next day I go and have a lot of cake and chocolates and just go all gaga that I'm fine now and go have a burger and just my health, then of course I can get it back.
Okay. It's been 3 months and I'm married and have PCOS. Is it possible to conceive?
Yeah, it is.
Yeah, I think this question was answered earlier actually. So if anybody hasn't gotten those answers yet, you can just go and rewatch the session. We'll be posting this right after we are done, and you can go and check it out. Okay.
Right.
I have PCOS from 5 years, and my periods only come when I take medicine. Should I try Ayurvedic treatment?
Yes, you should try Ayurvedic treatment. Just relying on hormonal medicines to give you periods, those are not even real periods. The periods you're getting of medicines is just artificial blood to say in one way, because it's just in hormonal withdrawal which is giving you bleeding, the real endometrium shedding. So yes, you should stop medicines, go for Ayurveda, go for homeopathy, go for yoga, go for naturopathy, go for any natural treatment rather than relying on medicines.
Okay. I don't want to take meds and get periods, especially after getting married, so I'm really worried.
I did not understand that one.
Yeah, I think it's yeah, okay, we can skip that, or maybe you can just write the question again.
Yeah.
What can I do to treat PCOS? Once again, you can just go and rewatch the session. We have answered this question earlier, and I think you can find your answers there. Anybody, any more questions?
I think there are a few in the chat as well.
Yeah, I'm just trying to see this. Can we conceive with thin endometrium?
Sorry, can we
around 6 mm? Can we conceive with thin endometrium around 6 mm?
No, you need a certain measurement of endometrium for the baby to sustain or stay in your uterus. So if your endometrium lining is really thin, you need to work on that. You need to take the proper medications to improve your endometrium lining.
Okay. I think those are all the questions that we have for you today.
There is one question I would like to answer. That reason of delayed periods and pregnancy test. This is a very common question that females ask me, that ma'am, pregnancy test negative आया है पर periods नहीं आया है, तो exactly क्या है? So exactly ये है that only for that particular month you have taken a lot of stress, you have maybe done something extreme, and your period cycle has gone for a toss. Doesn't mean that every time your period is delayed you are pregnant. So you need to get a urine pregnancy test done. If it is negative, that means your period is delayed for some other reason, and you have to till you get your periods. If you still did not get it till 40-50 days, then please meet a gynecologist and find out why is it getting so delayed. Okay, all right. Can you advise what is the right lifestyle to follow after irregular periods? So start working on your weight if you are overweight, that is. And if you're lean already, then work on your skeletal muscles. So females usually think that, I am doing a lot of cardio and everything, and so it's fine. So the main exercise for PCOS is actually strengthening exercises. You have to work a little more on your muscles rather than your fats. And so that is one that you can bring in yourself.
Please suggest some Ayurvedic medicines for PCOS.
So I am not, authorized to suggest any Ayurvedic medicines for PCOS. You have to get it diagnosed that with a Ayurvedic doctor, that what exactly is your problem. There is no general medicine for this. They will look at you in particular, what symptoms you are having, what difficulties you are having, what age you are in, and then give you the medicine. There is not this, so it's not like a crocin that anybody can just pop it up. It has to be specific for you, and so you have to take the effort to go and meet a gynac and get it for yourself.
Okay. Is changing only diet sufficient, or exercise is mandatory to get rid of PCOS?
You need a balance of both. Only dieting won't help, only exercising won't help. It's like the railway track. You need both the tracks together, otherwise the bogie is going to fall.
All right. Anybody have any more questions for Dr. Hello, can you hear me?
Yeah.
Sorry, you got stuck again.
No, we can hear you.
Yeah, okay. All right, I think that's all for today. Thank you so much, Dr. Reema, to join us today and answer all these questions. It was delightful to be here. I hope we see you again.
Thank you so much.
Thank you so much. Bye. Bye-bye.
Bye.